Hi, my name's Jasmin Henry. Today I'm going to be talking about vaccines and why they should be mandatory. So, due to the anti-vaccination movement that's currently really on the rise, we've started to see an increase in preventable diseases that some of them we hadn't even really seen in person for a long time. Um, a lot of them we were almost really close to eradicating, and now we're starting to see a little bit more of an increase in them. We need to take issues like this seriously because this issue applies to everybody. Um, our children, us, the elderly, we need to protect ourselves and our children and our families from these diseases. So in 1998, Dr. Andrew Wakefield published a study that has since been retracted. It was retracted in 2010, where he linked the MMR vaccine, that's the measles, mumps, and rubella vaccine. He said there was a link to autism, um, but any subsequent studies after that didn't find any link. But it didn't matter, the damage was done and people stopped vaccinating their kids, the rate started to decline. Because people were afraid that their kids were going to get autism, and even if that were true, would you rather have a sick, possibly dead child or an autistic child? Um, so, of course, this started a trend. People started, you know, on this path to no vaccines, where it was, at first it was just no MMR, and then it started becoming no vaccines. I've been a healthcare worker for about 6 years. My first job was when I was a new medic. My first duty station was in Korea. I worked in the pediatric clinic at 121 Brian Allgood Army Community Hospital. I used to scrub the pediatric vaccination charts, and what that meant is that I would grab the one recommended scheduled chart, and then I would look at the child's chart and I would cross-reference, make sure they had everything that they needed, and then if they were missing anything, I would be the one to administer it. And there was quite a bit of vaccination education that I had to do. I had to tell the parents what it was for, how this benefited the child, and all that. I also when I left the Army, I worked in El Paso Children's Hospital and the oncology and hematology ward. That would be the cancer ward. And a lot of those kids are what we call neutropenic. It's a side effect of chemotherapy. It means their immune system is basically so beat up that it's weak, it can't fight off infection. So a lot of those kids rely on what's called herd immunity, which means that the rest of us that have been immunized, we don't catch these diseases, therefore we don't give it to them. So us being protected protects them. It saves their lives, quite literally. So in the aftermath of Dr. Wakefield's study, as I said, that was a huge blow to the science community, and they've yet to recover from it. In fact, I think it's probably as bad right now. It's been worse than it has been in previous years. And that is because people have the internet in their pockets now, and they think they know more than professionals because Dr. Google tells them this and that. And I hear a lot of don't take anything that you can't pronounce, which is a funny thing to me because if I told you that I'm going to give you acetylsalicylic acid for your headache, you would probably freak, but that's just aspirin. And yet people are scared because they don't fact check. They go on mommy blogs and such, and we know how that goes. So limited medical knowledge of everyday lay people leads to misinterpretation of often legitimate sources, but often they also take illegitimate sources that are biased, and treat them as real sources. One big example is thimerosal. It's a type of mercury. It's used as a preservative in vaccines, although it's nowadays usually just used in the flu vaccine. It's used to stop the growth of bacteria. People hear mercury, they think mercury is mercury, all mercury is created equal, and that's just not true. Thimerosal is different than the mercury in fish, which can harm you because it stays in your body. Thimerosal does not stay in your body. So it's things like this that people freak out about because they don't understand the differences. Again, with the Google and the internet and the mercury and all that, parents do research, they find mommy blogs, they ask each other questions, they don't know the answers, they just assume. One of the big ones is vaccine injuries. People claim anything from skin rashes, and don't get me wrong, there are legitimate allergies to vaccinations, but people claim anything from skin rashes to coordination loss, blindness, autism, death. Stuff like that is so rare, and people are just claiming it like it's so common, like it happens every day, all the time, multiple times a day or something like that. They're treating it like it's an epidemic or something. But they don't realize that vaccines are these life-saving, amazing inventions. In 1921, before the vaccine for diphtheria was developed, 15,000, well actually more than 15,000 Americans died from diphtheria. I've never even seen diphtheria in person. And that is because there's only been 2 cases between 2004 and 2014. 2. The chickenpox vaccine came out in 95. I was born in 94. The vaccine is typically given around the 12-month of age mark. I never got chickenpox because of that. Because by the time I was old enough to get it, it had just come out. I was given it. I therefore never got it. I've never seen chickenpox in person. And I work in a hospital. Isn't that incredible? I've never seen it. My sister, she was born in 2004. She never seen it. And my daughter, who is 2, will probably never see it at all. If I just think that's incredible. Chickenpox, something that used to be so common, and so people used to think of it as like a rite of passage almost. This rites of passage almost leads me to boosters, because whereas we treat things like childhood illnesses as nothing crazy, we treat booster shots as something even less serious. Stuff like the flu. People just don't want to get their annual flu shot. They think, oh, it's just the flu, it doesn't matter. But this takes me back to somebody I used to work with, or used to take care of when I worked at Children's. His name was Adrian, and I do have his permission to use his name from his mom, because she wanted me to help spread awareness of this. Flu vaccines. He was neutropenic. And she, like many people, said, I don't need a flu vaccine, it's just the flu. Well, she ended up catching the flu, which would have been no big deal, but Adrian didn't really have an immune system, so she gave it to him. And he spent a while in the PICU, the pediatric ICU. He came back to us, he was doing okay, we discharged him, and then he was doing not okay again. He came back. 3 months after that, he died. It was a steady decline. His organs started shutting down. He died from the flu, which shouldn't have happened. He was in the hospital so long, and it shouldn't have shut his organs down like that. But that one decision of somebody in his surroundings thinking it was no big deal, she didn't consider herd immunity, and now he's dead. And people don't think about that. People just think, oh, I don't want to. People always say, oh, I always get sick after I take it, but you can't get sick from a flu vaccine. It's just your body's reaction to it. It's something mild. People always think, I don't want to feel crappy. Well, what about the person next to you, the people around you? You wouldn't feel that way if it was your child who had neutropenia, if it was you who had neutropenia. So we need education on these compounds that go into vaccines. We need to start this as soon as people get pregnant, possibly, during prenatal visits. We need to educate on the compounds that go into these things. We need to educate people on things like the dose makes the poison, such as formaldehyde, which is also in some vaccines. There's more formaldehyde in a pear than there is in a vaccine, so if you're afraid of vaccines, please stop eating fruit. Some states are enforcing vaccination laws. They're fining. Some doctors' offices are no longer seeing children, and that is a step in the right direction, because parents will have nowhere to go. Their backs are up against the wall if they're not doing this for their children. Yes, the costs for this will be expensive, but I think it's worth it because lives are going to be saved. So vaccination rates go up, diseases go down, and that is exactly what we want to see. Contrary to popular belief, the healthcare field workers don't want you to show up. We would like a quiet day once in a while in the hospital where, I mean, who doesn't at work? Um, of course, we will never see a 100% vaccination rate. That's just impossible. Because, medical exemptions, people continue to be butts about the whole autism thing. But these vaccinations allow us to live without fear of serious diseases. And I think that's fantastic. But it's not right that suddenly people are acting like things like measles and mumps are no big deal when a long time ago they killed in the thousands. That's insane. So I ask people this all the time. If it was really true that vaccines caused autism, so you would rather your child be dead than autistic?